So you have a diagnosis of cancer, and the question is, what do you do from this point forward? There are so many strategies in both the mainstream and in complementary and alternative medicine that it's overwhelming for any individual to try and master them all. That actually includes the mainstream cancer doctors as well as those that treat complementary and alternative styles as well. So we have a problem that we can't go to any single resource most of the time and get the answers that we want that are balanced. So we have to do the best that we can to see multiple practitioners. Of course, it's good to see the mainstream doctors first. You want to see your surgeon, oncologist, and person who might be doing chemotherapy or radiation. Those are important things to do. But you'd also like to know what other things are possible. What are the complementary and alternative approaches? What are the integrative strategies that you could use maybe in combination that might give you a better outcome than when you get in any single approach that you take? There are many approaches that I think are possible to consider. And generally, a combination of trying to kill the cancer cell, which is what we do mostly in the mainstream, in combination with something that supports the body's defenses and makes us stronger, is what we're looking for. And so when we're looking at complementary and alternative strategies, there are hundreds of different approaches we could take. There are approaches with nutrition. You can use intravenous vitamin C. We can alter temperature to use things like hyperthermia, which is beginning to be studied into the mainstream as well. We have approaches that include prayer and group support and approaches like that all seem to make a difference. When we're looking at the main approach that most complementary and alternative doctors use, particularly those that are into orthomolecular or nutritional medicine, we're looking at trying to make the body work as efficiently as it can. So things like alkalinizing the body. We've all heard the term the alkaline way. And what that's really talking about is how do we balance the body's pH system so that it works the best it can to make its enzymes do what they need to do to keep our body functioning at 100%. And keeping us just a little bit alkaline is important to accomplish that. So we have diets that we can give, and there are sheets that can be used that can tell you which foods are alkaline, which ones are acid, and then if we measure urinary pH in the morning, we can know if we're balanced that way and at least be getting optimum function out of what we do have in our body. We can boost our immune system. There are many ways to do that. There are many things like mushrooms or herbs or some nutritional products that will support that. And there are plenty of places on this site where you can look to see some of the specific strategies that we use in complementary and alternative medicine, as well as some of those strategies that talk about what we're doing to boost immunity. Maintaining the intestinal tract so that it can do what its job is best, which is to digest, absorb the best foods that we need to take in, and to keep the toxins out. If our digestive tract isn't doing what its job is, you can eat the best diet in the world, and you're still not going to be taking in those nutritional substances that our bodies need to be able to build its defenses to work optimally. And then we should be looking at lifestyle factors as usual. All the lifestyle things, the diet, the exercise, stress reduction, sleep, avoiding toxins, making sure our weight is what it should be, and of course having a meaningful purpose in our life. These blended strategies make a combination of therapies possible. And unfortunately, because you aren't an expert in this, you're going to have to do a bit of homework. And some of the articles on this site are ones that you're going to want to look at and listen to, because what they're going to do is give you ideas of what's available. And maybe some of those leads will take you to strategies that might give you a better, integrative, and holistic approach to managing your cancer the best way that you can.